Ladies and gentlemen, I am Dr.N.SUKUMARAN, continuing with the video which title is Health is Your Birthright. Dear friends, now our topic, that is thyroidism. When we talk about the thyroidism, immediately it comes to mind the hypothyroidism and hyperthyroidism. The enthusiasm of the people, that is the fulcrum of the happiness in the society, is being definitely hampered because of this many people. That is about 40 to 45 million patients in India alone are suffering. They to smile, to participate in their day-to-day life happily, to so many complaints. They cannot get good sleep, they cannot get good memory, many of similar things which I shall explain in the symptom picture when discussed. People should be aware of it, how to contain it, what can be done about it, and whether it is within our reach. Now, when it comes to symptoms, the main symptom what one is observing is the tiredness, the weakness, the inability to be enthusiastic. That will be missing from the individual. Then automatically the tiredness brings laziness. Laziness will bring a feeling that one is doing enough what is assigned to him or her. And then comes to the hair, which everyone cares very much, it falls off. The eyes are dry. Your skin is rough and dry. No energy. In the morning, getting up with great difficulty, and always you are in a worrisome mode. The ratio of the thyroid population, that the gents are in a beneficiary role, in the sense only about 20% of the male population suffer, whereas about 80% of our sisters and mothers are involved in it. Now, other group is there, that is right from the birth of the child, that is called cretinism or neonatal thyroidism, which fortunately these days are being attended at the pregnancy level itself in various hospitals and facilities. The autoimmune disorder brings another picture, which normally the medicines indicated for thyroidism will not be able to manage, because it is your immune system is attacking your own system. So there might be some reason. Let us see whether we can come out of it, or any way is there to come out of it, that we shall again see. Now, autoimmune diseases, that is directly the result of your stress. The entire world is under stress, and India in any way is not lagging behind it, but learn to live either with stress or leave the stress alone, so that not only with respect to thyroid, many of the autoimmune disorders can be managed very well. We cannot always go on Visalon or similar corticosteroids to counter this kind of autoimmune diseases. The results, long-term results, would be disastrous. Now, what are the common symptoms we can see in the thyroid patients? I have already told that your skin will be dry, you will have hair fall, your eyes will be lusterless, but the more damaging symptom is ladies' inability to conceive. That's a major challenge I am seeing on looking at the face of the young couple. In 1984 onwards, we are having a national approach towards thyroid, and to mitigate the suffering of the larger population, the salt is iodized. Alas, we are in 2021. The type of improvement we should have received, just not seen anywhere. In fact, there is a doubt whether it has adversely impacted thyroid containing program. The intention was noble, but the result is definitely not up to the mark. So, merely providing the iodine in its synthetic form will not solve the problem. What we need is a judicious approach. You mind it, let it be salt, let it be calcium, let it be any sort of nutrition, let it be iodine, it as far as possible must be available from the natural sources. Your system should digest it. Your liver should support it. If you will take lot of calcium, synthetic calcium, then your after a level it will not be accepted by the body. Same is the case with the sodium. Same is the case with the iron. You supply it from out sources. No, the system will not accept it fully. In the initial 1 or 2 days, there will be some differences, but slowly the system's capability will take a back seat. It will very intelligently conclude that I am getting all these materials, why should I work to absorb it? There onwards we are in disturbed phase. It is called rejection phase, and the result is not very pleasant. So, my dear viewers, we have to find out the sources, natural sources for getting iodine, so that we will be in a position to manage our thyroidism in a better way. Food can play a major role in containing this disturbance. How is it possible? What we need is very paltry sum of iodine for day-to-day functioning. The pituitary will instruct the thyroid gland to produce enough iodine, and if iodine is more or less, the problem starts. So, it might be ideal to find out which are all the natural sources of iodine. Earlier in South India, the thyroidism was less, and in North India it was slightly higher. The reason, in that area the land doesn't contain lot of iodine as seen in south, but of late almost everywhere, North India or South India, it is same, thanks to availability of artificial iodine through the salt. So, we have to find a way out. Can you get natural salt? If possible, you use it. Okay, 1 or 2 people may not get, in spite of that, the sufficient selenium or zinc or iodine as need be. These are all the linked components which will create a conducive condition for the thyroid gland to accept iodine. Now, the non-vegetarians and vegetarians. Non-vegetarians have ample sources of iodine, that is especially the sea fish, and vegetarians will have to depend on non-sources of iodine like white pumpkin, aradhania. These are all full of iodine which can meet your daily requirements. For the availability of selenium, one can go for tuna, chicken, eggs, shrimps, and for vegetarians there are oatmeals, whole wheat bread. For making sure of availability of zinc, you can go for oysters, chicken. It will be better if you will avoid the barred items like cauliflower, cabbage, soya items, and ready to eat food items. Calcium absorption is an ingredient for the availability of iodine. So, calcium cannot be given directly. In fact, the thyroid complaints emanates even from abuse of calcium and antacids. I remember the Ayurveda Vaidyas of my village used to take the patient who is suffering from hypothyroid to the seashore of Arabian Sea in Charthala. And I was not knowing what exactly is happening by going there. They used to get the top layer of the foam, add with a little butter and have it, and then come back. And when it comes, the sea breeze is there, it also carries the iodine. Just inhaling that iodine, it is sufficient to meet the one day's requirement. One unfortunate thing what I have noticed is the fasting continuously for number of days, especially by ladies who were relying on non-veg items due to certain religious reasons. Once that season is over, number of people do come with hypothyroid complaints. That always keep it in mind. In case you are stopping non-veg items, it must be properly compensated by vegetable items containing iodine. Some of homemade medicines are fucus, which is containing iodine in its truest form, then thyroidinum, natrum mur, lycopodium, lycopus vir for hyperthyroidism, and number of such remedies based on the symptom picture you are presenting. The nearest doctor will be of very much helpful to you. The patients who are suffering from thyroiditis or goiter, and sizable number among them might turn as cancer patients. The remedies might differ, but there is nothing to worry much about. More is a sort of care. What is that care we can take in within your powers? One is be stress free. Number two, you sleep in time. Number three, you do exercise in open air, because vitamin D is very much essential. Friends, I hope you have understood my suggestions properly and will be able to lead a happy life. Friends, number of requests I have received that in next episode I must on an urgent basis include migraine as a subject. Yes, next episode will be on migraine. We shall meet again. Till then, Dr. Sukumaran. Thank you.